Is this on? 1, 2, 3. Testing. Friends, how we doing today? I'm starting a different style of a series here where I'm going to be sharing some of my experiences. I see there's a community of male nursing students and I think male nursing professionals. So I think it's just a nice thing to start a series where I share some of my experiences reflecting back on being a nursing student, on some of my rotations, maybe some things in my career, but I'm going to start with just nursing student rotation of labor and delivery. And I have a story, a learning experience at the end, so stay tuned for that. But in this video, I just want to give you guys my general experience, some of the things that I've experienced on this floor, maybe some tips with it, some things to look for, and some things to expect, right? And at the end, I'll end with the story, which, like I said, is a learning lesson. So, labor and delivery, friends, you're going to have to go through this unit. It doesn't matter if you're a male or a female nurse, you're going to have to do it. And I mean nursing student. You're going to have to go through this experience. A lot of female nursing students love L&D, a lot of them. They're always looking forward to it. Semester 1 and you're going to start to hear it. Hey, labor and delivery unit, you're going to hear it. And understandably, a lot of them actually desire to be an L&D nurse. Like that has been their goal and they're going to look forward to that rotation. As a male nurse, I was the complete opposite. I was not looking forward to the labor and delivery clinical rotation. OB health, right? Women's health. There's going to be a whole class on it. That was cool. Like I'm cool with that. Like I needed to know this information. I needed to know women's health. It helps me be a better partner. It gives me just a general knowledge and foundation, right? If you go work in a hospital or in the ER or in a general med surg floor, you need to know women's health in particular, right? It's just different. I was going to say they're easy, but it's just different. You need to specifically know women's health because they can get pregnant, right? And that's where the whole labor and delivery rotation stems from. Right from the jump, friends, I'm just going to jump into it. Right from the jump, it's not going to be like general med surg clinicals. In general med surg clinicals, nursing staff is going to be pretty eager to take students, right? They look forward to it. I think a lot of them actually write it on their resumes, and if they ever want to be a nurse educator, they can say, they've done preceptorship for this long. And it's very helpful. And it's different. It doesn't matter if you're a male or female. There's male and female patients, right? You can experience, some type of, rejection on the general med surg floor if you have a female patient not wanting a male nursing student, but it's far less common. In labor and delivery, it is much more common. And it's understandable. It's an intimate floor, right? It's an intimate moment in someone's life, especially the birth of someone's first child. I noticed on that rotation that from the beginning, I didn't really feel wanted. And well, how is that apparent? Well, on general med surg floor, people pick up students like it's hotcakes. On the labor and delivery unit floor, the female students get picked up first. And then as the male nursing students at the end, you get picked last, right? You just get picked last. And it's going to be like that. You're going to have to go ask nursing staff, hey, can I follow you? And some of them are going to say, no, I'm busy. And some people aren't going to really want you, right? But they'll take the female nursing student. But as a male nursing student, you're just going to make their job that much harder. You're making it harder because they already have to teach a student and have a student shadow them. But also on top of it, you're a male nursing student on a female-dominated floor. Labor and delivery is all about women's health. It's a female-dominated floor. OB is a female patient, right? Like that is the main target patient population is females. So as a male nurse, it's going to be tough. As a male student nurse, it's going to be tough because you're not even professionally working on that floor. It is not your duty professionally. You're not getting paid for it to provide care. You're just there to learn, observe, practice skills. So good luck. Good luck to you. My experience overall in OB was fine because I eventually learned how to adapt. I recognized I didn't really feel super wanted, so because of that, I didn't get all the skills and experiences I really needed that I was learning in the coursework. But professors are pretty lenient. They understand that as a male nurse, it's tough for you to get into rooms sometimes. You can always say if you're in that class and you're a male nurse, right, or on that rotation, hey, the patient, had to respect their wishes. They didn't want, a male nursing student in there. And oftentimes that is going to be the case. One thing to consider if you're trying to get into a room is what I recognized is that when it's the first child born, right, it's harder to get into that room because it's the first time. It's a very intimate moment. I noticed that the mothers who had their second or third child, they were already more willing to have a male nursing student in there. Like it was another time that they were going to give birth. It didn't mean as much, which was funny in a way to see that contrast. But it's understandable, right? The first time is always scary, always more, meaningful. Not to say that other births weren't meaningful for these mothers, but it's just something that I noticed. It was interesting. One thing that I really did and I took to my advantage in L&D was knowing that, I wasn't wanted, right, by the patients or the nursing staff. So I would bring my textbook. I would do homework while I was there. I'd hang out at the nursing station, which I was treated better there than when I was out in trying to find rooms and a nurse to follow. Like the nursing staff were like, oh, I guess he accepted he's just here. He's just going to do his thing and, get his hours done out the way and just kind of be out the way. And I noticed as long as you're kind of out the way, you still get your hours done. You can catch up on homework and just let your nurse know every once in a while, hey, if you see something interesting and the patient is willing, can I follow you? Can I see what you're going to do? And I think I saw the nurse, check for dilation a few times, but I never did it myself. I think in my program, in my class, there's maybe 1 or 2 male nursing students who were able to check dilation, but I think they were really pushing for it and trying to get the skills and the hands-on experience. I think they wanted to work like ER or something. For me, I always knew I didn't really want to work in a hospital. I wasn't really pushing, to learn that experience. And I work in a prison now where it's all males. It's just a male patient population. So I never really had to learn that, right? So you got to kind of see where you're trying to go in your future career and decide if you're really trying to pursue learning these skills. If not, you'll get them when you're actually oriented on the floor and working, right, in the ER and all these other things. And maybe then it'll be a better experience for you because you're getting paid for it. You have to do your professional job. You have to do it. As a male nursing student, you don't really have to do any of this. So I think that's kind of why you get treated this way a little bit. But my biggest tip, friends, and this is kind of where my story is going to tie into, my biggest tip on how I survived the L&D rotation is I was hiding in the NICU. The NICU is the neonatal intensive care unit. So it's, an ICU, but for babies and infants. Oftentimes you'll see premature babies in there. You'll also see babies who are born sick with, some type of illness or disease or condition. And you'll also see NAS babies, which is neonatal abstinence syndrome babies. These babies, sadly, are the babies whose mother was, abusing some type of substance. It's most likely opiates. And, because they would withdraw without them, the baby is no longer inside the mother, so they're now withdrawing without having the opiates, right? So it's really sad. The baby's born into this world already having to deal with this problem of withdrawals. So they're NAS babies, and they're in the NICU. So my biggest tip for you, friends, is I recognized when I had to do a day or two in the NICU, is that those nurses were way nicer, and because the patient was different, right? I didn't have to deal with the mother and the family unit dynamic. I was just dealing with the baby, and the baby was way easier to care for. They didn't judge me. They didn't say they didn't want me. They allowed me to feed them, change their diapers, hold them, burp them, sleep them. It was all a good experience once I found out that, hey, I just got to hide in the NICU. So then I just hid in the NICU for the rest of my days. So I went from kind of not knowing where to go, and then eventually I connected with that nurse and be like, hey, is it cool if I'm in the NICU again with you today? And they're like, yeah, come on in. And then I would just stay in there. So find your NICU if you don't feel wanted on your floor, and you're going to find something to do. They always need help holding babies. Always. They always need help holding babies, feeding babies. They barely have enough time themselves. So as a student, they're going to love you because now you found a place that you're wanted for yourself, but they also actually need your help. So keep that in mind. So where the story comes in, friends, on the labor and delivery unit floor, there are ankle bracelets that go on babies' ankles or their wrists, but I think it's typically their ankles as a security measure, right? Be on the lookout for these things. Be on the lookout. I think most hospitals, the ones that I went to, had them. Maybe yours have them as well. So what happens is there's always this concern for babies and kidnapping, right? So they put these sensors on their ankles, so if the baby ever leaves the unit, there's an alarm that goes off, right? So you need this as some background. So one of these NAS babies was out when I was in the NICU, was getting ready for discharge. Oftentimes an NAS baby doesn't have their mother there, so it's not the mother, taking the baby home. It is like a foster family, right? Taking these babies home, and then eventually they'll get adopted. So I saw that process. I saw the process of a discharge of an NAS baby. I wasn't really involved. I was just observing, saying, oh, that's cool, that's interesting. And then eventually towards the very end, I wasn't really in the room. Another nurse called me in and be like, oh, hey, Jesse, hey, can you put that baby down and actually help this family, take their baby out to the car? And I was like, okay, I was like, did they sign everything? Are they ready to go? And they're like, yeah, they're good. And this was like a little bit of a busier day because they had some other things going on. I think one of the babies was not well, in the NICU. So it was like a quick discharge. And I'm like, okay, yeah, I'll be helpful. Like, I could do that. So, as I'm waiting for them at the front desk, right, a lot of eyes were laid on this baby. The nurse in the NICU, the nurse at the nursing charging station, and, me, right? They do the final signature and they say, okay, you're free to go. I take this baby, right, in their car carrier, and I walk out the door. And as soon as I walk out the door, it says code pink. And an alarm goes off. Code pink is a code for infant abduction. So like I was saying earlier, when a baby leaves the unit, that code's going to go off and people are going to think some baby's missing. Well, because I just went through the whole paperwork and process with the nursing station, and all these nurses saw this baby, and I'm walking out with this family that everybody greeted, security, everybody saw. Security ran right past me holding this baby, and they were booking it down the stairs. Another one was booking it the other way, right? Going into the unit. And I'm just here with this baby, and I'm just like, is this the baby? And by that time, we were already like halfway in the elevator, like coming out of the elevator. And then we like don't end up going in the elevator, and we go back to the unit. And I'm like, is this the baby? And they look at the baby and they're like, oh, it is. And then I didn't know about the security bracelets until that moment when the nurse was like, oh, I forgot. There was that bracelet. We never took it off. And that's how I found out that there was these bracelets, friends. So code pink, I'll never forget it. It's infant abduction. And the babies in the hospital on the L&D floor have bracelets on their ankles for security purposes in case someone like myself takes a baby out. And yes, they do work. As soon as I stepped and closed the door out the unit, that alarm went off. And I didn't recognize it because I had no idea this bracelet was on this baby until I was in the elevator about to go down. So friends, this is the first video here. Hopefully there's something here of value that you can take away. If you have any questions about any of this of L&D, leave them down below. If you already have done L&D and you had something to share, I think it'd be cool. Leave it also in the comment down below. But otherwise, friends, I'll see you in the next one. As we always continue to try to improve. See you then.